Verifying my doctor's orders, gathering all my equipment. Knock, knock, knock. Shutting door for privacy. Hand hygiene. Scanning the room. Putting on the PPE that's needed. Airway, breathing, circulation looks good. Everything seems to be intact and working properly. Hi, Miss Roxy. My name is Taylor. I'm an ACC nursing student. Can you give me your name and date of birth, please? Alrighty, great. I'm going to check your MR number as well. Okay. Are you in any pain right now? No? Okay. You seem to be in pretty good health and alrighty, great. Well, today I'm going to be performing a physical assessment. Do you have any questions? Okay, great. Do you have any allergies? No allergies? Great. Well, I'm going to raise the bed to a working position and lower the bed rails. I see that your breakfast tray is here. Did you eat your breakfast? Yep, okay. Do you have any trouble swallowing or eating? Any pain with chewing or swallowing? Okay. Did you happen to also go to the bathroom? When did you void last? This morning? Okay, great. And that was the color okay? The smell, you didn't have like an odd odor? The color was like a light yellow? Okay, awesome. You didn't have any pain going to the bathroom, did you? Okay, when was your last bowel movement? Last night? Okay, and that's normal for you? Okay, awesome. Well, I'm going to start by taking all of your vital signs. Blood pressure, 120/80. Your pulse, about 65. Respiratory rate, with your chest rise and fall, is about 16. Your O2 sat, 95%, and temperature, 98.2, which is pretty good. You seem to be alert and oriented. Do you know who I am? Nurse Taylor, yes, correct. Do you know where you are? Taylor's Hospital, correct. Great place to be. Do you know what year it is? 2021, yep. Okay, can you go ahead and press against my hands? Okay, great. Your extremities seem to be equal strength. And you don't have any like numbness anywhere or pain? Oh, okay, awesome. And you're hearing me okay and understanding me? Alrighty, awesome. And no, I'm also gonna check. I'm going to check your pupils. Okay, and go ahead, follow my pen. Without moving your head, follow my pen. Okay, great. Accommodation. Okay, great. Your pupils seem to be equal, round, and reactive to light, and your accommodation test was good. I'm going to go ahead and check in your mouth. Say, ah. Ah. Great. And up your nose. Okay, good. Mucous membranes looks good. Pink and moist. I'm going to go ahead and look in your ears. No discharge. You did say you were hearing me good. That's great. Okay, now I'm going to go ahead and check your breath sounds and lung fields. Okay. Alrighty, putting my stethoscope at your throat. I'm listening for bronchial. Take a big deep breath. Okay, moving down. I'm listening for your bronchovesicular on both sides. And moving down again, I'm listening for your vesicular. Big deep breath. Both sides, one more deep breath. Okay, great. Now I am going to lean you up and I'm going to palpate your scapula and your spine. And I'm going to zigzag. Big deep breaths. One more big deep breath. Okay, great. And while I'm back here, I'm just going to check for any skin lesions, rashes, or redness, or breakdown. Everything seems good. Great. Your breath sounds sounded good. No crackles, wheezing, or rhonchi. And you had no pain breathing in and out? Okay, great. Now I'm going to go ahead and check your heart sounds and your rhythm and all that. Alrighty. Placing my stethoscope on the right side of your second intercostal space, right side of your sternum. I'm listening for your aortic S2 sounds. And then moving over to the left side of your sternum, second intercostal space, I'm listening to your pulmonic S2 sounds. Okay, moving to about the fourth intercostal space, left of the sternum, I'm listening for tricuspid. And moving to the midclavicular line, left of the sternum, about the fifth intercostal space, I'm listening for your apical on your mitral valve. S2 or S1. Okay, great. You had a good, strong heartbeat, pretty good rhythm and rate, and you don't have any, I guess, calf tenderness or anything like that. Okay, well, I'm going to go ahead and check all your pulses as well. So here's your temporal pulse, bilateral. And I'm going to check your carotid. But before I do, can you lean your head to the side? It doesn't seem like you have JVD. I'm going to check your carotid one at a time. Okay, great. I'm going to check your brachial bilaterally, your radial bilaterally, good. Your femoral bilateral, and your popliteal, and your dorsolaris pedis, good, equal, and strong, and your posterior tibial. Okay, great. And while I'm down here, I'm going to go ahead and check your cap refill on your toes. Seems good. Less than 3 seconds, which is good. Can you press against me? Okay, great. Your extremities seem to be good and equal. Let's do some range of motion. Pick your legs up and down, move them to the side. Abduction, adduction. That seems good. I'm also going to change my gloves just because I did touch your feet. Now I'm going to check your cap refill in your fingers. And it looks good, less than 3 seconds. And like you said, you had it doesn't seem like you have swelling in your legs, no edema. And you had no like joint tenderness, anything like that. That all seems good. Yeah, okay. Now I'm going to listen to your tummy sounds. So I'm going to have to lay you down for this. There we go. Okay. I'm going to listen to your tummy sounds in all 4 quadrants. Just for any, just listening to your sounds. Your abdominal sounds. Okay. Great. Your tummy sounded pretty healthy with all the clicks and gurgles. Now I'm going to feel for any, organ abnormalities or enlargements in all four quadrants. Okay, great. Everything seems to be good. And you told me the last time you went to the bathroom was last night, and that was all good, normal for you. I'm gonna go ahead and sit you back up. Okay, and you told me the last time you went to the bathroom, and I did a fall risk assessment when I came in. You told me you walked to the bathroom all on your own and you had no pain with that. Your gait seemed good. And your skin up here seems pretty, dry, intact. And your trigger, let's check that. That's all good. No redness or rashes or lesions. Or breakdown, anything like that. And then I'm going to check your surgical site. Your dressing seems good. IV site, looking good. No phlebitis or infiltration. Everything seems good. I'm done here. I'm going to go ahead and go. Do you have any questions for me? Are you in any pain at all? Okay, do you have to go to the bathroom? Nope. Okay, great. Are you comfortable in this position? Okay, do you have everything you need? Book, cell phone? Nope. Okay, awesome. Good to go. I'm going to lower the bed to its lowest position. I'm going to raise the bed rails. Here's your call light. You press this button if you need me, and I will come running to you. Okay, I'm going to take off my PPE and throw that away. Hand hygiene, and I'm done.